Moving forward with node-positive breast cancer is overwhelming, but I never just found my way. I made it and did all I could to prevent recurrence.
Verzenio reduces the risk of recurrence of HR-positive, HER2-negative, node-positive early breast cancer with a high chance of returning, as determined by your doctor when added to hormone therapy. Hormone therapy works outside the cell, while Verzenio works inside to help stop the growth of cancer cells. Diarrhea is common, may be severe, or cause dehydration or infection. At the first sign, call your doctor, start an antidiarrheal, and drink fluids. Before taking Verzenio, tell your doctor about any fever, chills, or other signs of infection. Verzenio may cause low white blood cell counts, which may cause serious infection that can lead to death. Life-threatening lung inflammation can occur. Tell your doctor about any new or worsening trouble breathing, cough, or chest pain. Serious liver problems can happen. Symptoms include fatigue, appetite loss, stomach pain, and bleeding or bruising. Blood clots that can lead to death have occurred. Tell your doctor if you have pain or swelling in your arms or legs, shortness of breath, chest pain, and rapid breathing or heart rate, or if you are nursing, pregnant, or plan to be.
I'm making my own way forward.
Ask your doctor about everyday Verzenio.
With thyroid eye disease, I hid from the camera, and I wanted to hide from the world. For years, I thought my TED was beyond help. But then, I asked my doctor about Tepezza.
Tepezza is the only medicine that treats TED at the source, not just the symptoms. In a clinical study, more than 8 out of 10 patients taking Tepezza had less eye bulging. Tepezza is an infusion. Patients taking Tepezza may have infusion reactions. Tell your doctor right away if you experience high blood pressure, fast heartbeat, shortness of breath, or muscle pain. Before getting Tepezza, tell your doctor if you have diabetes, IBD, or are pregnant or planning to become pregnant. Tepezza may raise blood sugar even if you don't have diabetes, and may worsen IBD such as Crohn's disease or ulcerative colitis.
Now, I'm ready to be seen again.
Visit mytepezza.com to find a TED eye specialist and to see Bridget's before and after photos.
I have moderate to severe Crohn's disease. Now there's Skyrizi.
Things are looking up, I've got symptom relief. Control of my Crohn's means everything to me. Control is everything to me.
Feel significant symptom relief with Skyrizi, including less abdominal pain and fewer bowel movements at 4 weeks. Skyrizi is the first and only IL-23 inhibitor for Crohn's that can deliver both clinical remission and endoscopic improvement. The majority of people on Skyrizi achieve long-lasting remission at 1 year.
Serious allergic reactions and an increased risk of infections or a lower ability to fight them may occur. Tell your doctor if you have an infection or symptoms, had a vaccine, or plan to. Liver problems may occur in Crohn's disease.
Ask your gastroenterologist how you can take control of your Crohn's with Skyrizi.
Control is everything to me.
Learn how AbbVie could help you save.
Well, 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 look at you. You mastered the master bath. You created your own style. And you, yes you, turned a sourdough starter into a sourdough finisher. So when you learn your chronic dry eye is actually caused by reduced tear production due to inflammation, you take it on by talking to your eye care professional about Restasis, which may help you make more of your own tears with continued use twice a day, every day. Restasis helps increase your eye's natural ability to produce tears, which may be reduced by inflammation due to chronic dry eye. Restasis did not increase tear production in patients using anti-inflammatory eye drops or tear duct plugs. To help avoid eye injury and contamination, do not touch the bottle tip to your eye or other surfaces. Wait 15 minutes after use before inserting contact lenses. The most common side effect is a temporary burning sensation. Ask your eye care professional about Restasis. Now to trick out these lights. Visit Restasis.com to learn more.
Relapsing MS isn't the only thing I have going on. That's why my doctor and I chose Kesimpta. Kesimpta is different. It's the only B-cell treatment for RMS I can take at home once a month. Kesimpta was proven superior at reducing the rate of relapses, active lesions, and slowing disability progression versus Aubagio. For me, a once-monthly treatment just works for my schedule.
Don't take Kesimpta if you have hepatitis B, and tell your doctor if you have had it, as it could come back. Kesimpta can cause serious side effects, including infections. While no cases of PML were reported in RMS clinical trials, it could happen. Tell your doctor if you had or plan to have vaccines, or if you are or plan to become pregnant. Kesimpta may cause a decrease in some types of antibodies. The most common side effects are upper respiratory tract infection, headache, and injection reactions.
When I'm ready, I spend less than 1 minute a month taking Kesimpta. How I spend the rest of my time is up to me.
Ask your doctor about treating RMS with Kesimpta.
Moderate to severe eczema. It doesn't care if you have a date, a day off, or a double shift. Make your move and get out in front of eczema with steroid-free Cibinco. Not an injection. Cibinco is a once-daily pill for adults who didn't respond to previous treatments and is proven to help provide clearer skin and relieve itch fast. Cibinco continuously treats eczema whether you're flaring or not.
Cibinco can lower your ability to fight infections, including TB. Before and during treatment, your doctor should check for infections and do blood tests. Tell your doctor if you've had hepatitis B or C, have flu-like symptoms, or are prone to infections. Do not take with medicines that prevent blood clots, serious, sometimes fatal infections, lymphoma, lung, skin, and other cancers. Serious heart-related events and blood clots can happen. People 50 and older with heart disease risk factors have an increased risk of serious heart-related events or death with JAK inhibitors.
It's time to get out in front of eczema. Ask your doctor about once-daily Cibinco.
My husband and I have never been more active.
Shingles doesn't care.
I go to spin classes with my coworkers.
Good for you. Shingles doesn't care. Because no matter how healthy you feel, your risk of shingles sharply increases after age 50. But Shingrix protects. Proven over 90% effective. Shingrix is a vaccine used to prevent shingles in adults 50 years and older. Shingrix does not protect everyone and is not for those with severe allergic reactions to its ingredients or to a previous dose. An increased risk of Guillain-Barré syndrome was observed after getting Shingrix. Fainting can also happen. The most common side effects are pain, redness and swelling at the injection site, muscle pain, tiredness, headache, shivering, fever, and upset stomach. Shingles doesn't care, but Shingrix protects. Ask your doctor or pharmacist about Shingrix today.
I have moderate to severe ulcerative colitis, so I'm taking Zeposia, a once-daily pill, because I won't let UC stop me from being me.
Zeposia can help people with UC achieve and maintain remission and has been shown to reduce symptoms in as early as 2 weeks. Zeposia is the first and only S1P receptor modulator approved for UC. Don't take Zeposia if you had a heart attack, chest pain, stroke, or mini-stroke, heart failure in the last 6 months, irregular or abnormal heartbeat, if you have untreated sleep apnea, or take MAOIs. Zeposia may cause serious side effects, including infections that can be life-threatening and cause death, slow heart rate, liver or breathing problems, increased blood pressure, macular edema, swelling and narrowing of the brain's blood vessels, and increased risk of PML, a rare brain infection that usually leads to death or severe disability. Tell your doctor if you are pregnant or plan to be. Don't let UC stop you from doing you. If you're living with moderate to severe ulcerative colitis, ask your doctor about once-daily Zeposia.